A disability is something that has a major impact on your life.
Every disability is different.
And it's never the same thing for two people. I am blind in my right eye totally and partially sighted in my left eye.
I was 18 years old. We were traveling way too fast on a gravel road. Broke my neck, my back.
My Asperger's syndrome and my cerebral palsy.
I have anxiety and depression. People would have no idea just talking to me.
Being independent means different things to different people.
I want to live in my own house. I want to pay my own bills.
Live independently and not rely on other people.
When someone is not able to live as independently as they can, it does have a detrimental effect on people's physical and mental well-being.
It's no complicated thing. It's just that people with disabilities want to be included.
Plenty of people get stuck in ruts when they feel like they can't overcome something in their life. That's where LIFTT comes in.
Living independently for today and tomorrow. LIFTT. We help people of all ages and all types of disabilities find the resources or acquire the skills to live as independently as possible.
We serve the southeastern 18 counties here at the Billings office. We have a variety of things that we offer. We can help with grant funding for adaptive equipment.
Maybe a home modification so they're able to access their home. We help people to find that funding.
Helping people apply for Social Security benefits.
Medicaid, Medicare, housing.
They have a peer support group. Peer support, I think, is key.
Sharing life experiences is one of the most powerful things to help people who might be new to disability, who might be struggling with their disability.
Youth transitions is kids that are transitioning out of high school. They need to learn those adulting skills. It might be rent an apartment, learn how to grocery shop, budgeting.
Help someone advocate for themselves in a school or an employment setting. One of our biggest strengths is providing folks with information and referral. If we can't help you, we hope to know who can.
A lot of times we'll have a potential consumer call in and they think that they just have one need, and it turns out that we end up finding 3 or 4 things we can actually do for them.
You can just come in and say, hey, I feel like I have this going on. Can you help me? And we can, which is so cool to me. I love that.
Most of us on staff at LIFTT have identified ourselves as having one or more disabilities. That is helpful in many cases.
It's easier to empathize with someone when you yourself have struggled with a disability.
This is what we specialize in. This is who we are, and this is what we do.
And it costs nothing to go to LIFTT. It's a nonprofit organization and they're there to help.
Somebody that was a consumer that was working with LIFTT was asked to do an art project. He visualized that the balloon helps to lift people up. And then it became the logo, and it's stuck.
There's been success on all kinds of levels.
It's really rewarding to have a consumer go, hey, I was able to do this by myself today.
We want people to live their best life as independent as possible.
Live as everyone else in society and live as a part of society, not apart from society.
Everybody needs help. Sometimes you just need a little more help, and that's okay. That's absolutely okay.
There's plenty of life to live still, and there's a way you can do it. Keep chipping away at it, little by little by little.
Knowledge is power. Let's share it, for crying out loud.
Send us an email, give us a call. We'll do our best to help.
We can definitely help figure out what your needs are and get started on that. We're one of many steps in the path to independence, and we're happy to be serving people here in the community.
Good day and welcome to Living Well in Montana. Living Well in Montana is a program of living independently for today and tomorrow, or LIFTT, L-I-F-T-T as we like to call ourselves. LIFTT is what is known as a Center for Independent Living, meaning we are a center for advocacy and resources for persons with disabilities and the aging across 18 counties in south central and southeastern Montana. For more information about LIFTT, I encourage you to please visit our website at liftt.org or give us a call here in Billings at 406-259-5181 or in Glendive at 406-948-8500. So one of the bigger projects we have going on at LIFTT is a couple of grants running sort of parallel and cooperatively with each other, surrounding the topic of rural accessible transportation. And with me today to bring an update on the goings on in the rural transportation program through the planning grant as well as the operational side of it is our transportation coordinator, Tina Carter. Tina, welcome back.
Thank you, Jed. Thank you for having me today. And I am really excited to be here and to share with everyone what is going on with our transportation program. As you know, back in February, we had to do 500 surveys throughout the different counties, and then we had to do some focus groups to find out what the greatest needs were in each of our counties. And with our survey, I brought some stats here. The first question was, what is your age range? And out of the surveys we had completed was 520. About 79% were people who were 65 and older.
Okay. So again.
And then, whoops, got my paper upside down. What are the biggest challenges you face when it comes to transportation? And the number one was the high cost of transportation, and then the lack of accessible vehicles and poor road conditions, which a lot of people worry about that in the wintertime in Montana. How often do transportation difficulties present you from attending important events, activities, appointments? And 57% said sometimes. So, you know, that's quite a few people that are missing out on things. And then, what destinations do you need to go to most? And the number one, which was 91%, was medical facilities. Number two was the grocery stores and pharmacies. So we see a pattern here. And after doing the surveys and then the focus groups, the surveys were anybody in the county. The focus groups were specifically people who work with the elderly and disabled. You know, they were nursing home directors, or, you know, worked in mental health or worked at the hospital. And what I have found in these focus groups, the biggest need is transportation. The people in our focus groups, they worked with the elderly, the disabled, and their biggest concern is how are they going to get to their appointments.
And that's both within whatever community they happen to be in, as well as the fact that because our outlying communities are much smaller, people are seeking transportation to the larger communities.
Correct, yes.
For medical appointments, correct?
Yes.
Okay.
And so as we are going through this process, we've already had people calling and stopping by our office in Glendive. looking for transportation.
We've had
and it's happening here too.
cases
Okay, yes.
here.
So the word is getting out. It's fortunate that we are going to have this program. It's unfortunate it's not going to start until the beginning of 2026, maybe in the spring. The reason for that is the vans are being built now, and you just can't rush,
Right.
something
And for
like
the-
that.
Yeah, for the record, we're taping this in June the 3rd
Okay.
of
Yeah.
2025, and so you're talking 6
6
months
months.
to a year.
Yeah, about 6. Yeah,
Okay.
6 months.
Okay.
That's what we're hoping for.
Okay.
And the 2 vans that we are getting are 9-passenger. So we carry 9 passengers and then 2 people in wheelchairs. So each van can carry 11 individuals at a time, which,
Right.
in the scheme of things, that might not be a whole lot.
But
It's gonna help a lot of people.
it does fill in a
right.
need. And again, at one time, there was talk that sort of a first route had been decided upon, or maybe that's not.
Well, we have been
accurate.
talking about it, but we do know the transportation program will be stationed in Glendive,
Okay.
and then we'll go to the other outlying areas.
Okay.
In our focus groups, we talk to some of the people who already have their local transits. And Miles City does go to Billings a couple times a week.
Right.
And I know Ekalaka, Baker, they go to Billings. But both of those, they go to Billings, but they
Right.
still cannot support the number of people that need to go.
Right. So
So-
again, we're complementing
Yes.
existing efforts.
Right.
It's not
So,
that
you
we're
know-
coming in and taking over.
Exactly. Now in Glendive, they have the Dawson County Transit. It's just in
Right.
Dawson County.
Right.
The same way in Sydney. So a
Right.
lot of these counties, they just have their local.
Yeah.
But then you have places like Circle, Jordan, Webo. They don't have any type of transportation.
Right.
So
And from Webo, people have to go to Glendive to go to the doctor, right?
exactly, yes. And then Glendive. I mean, GMC is a good hospital. They have
Right.
some really good nurses and doctors there.
Right.
But if you have to go to a specialist,
Yeah, you're
it's
coming to Billings.
It's in Billings,
And the
yes.
same is true in Miles City and
Right, and even my husband has
Yeah.
to come to Billings for to see the lung doctor, and they wanted him to come every 3 months, and he said no. He said it's $100 just to drive there and back.
Right.
Then you eat, so he said it's not. So his appointments are every 6 months, and people have asked us, what is the cost going to be? We haven't gotten to that point yet, so that is something we're working out. We're working on our policy book and what the policies are going to be now. So just if you think about it, the way time flies, it's going to be here before you know it, and we're going to have our first maiden voyage, and I'm just so excited.
So you alluded to this survey and the focus groups, and again, you've given some of the impressions that we've gotten that that people need this program, and that
Yes.
that particularly for medical transport. But what are some other items that we sort of gleaned from the survey?
Okay, since we live in Glendive,
Okay.
our shopping is very limited.
Right.
And, I don't know if I should say this on TV, but you cannot even buy undergarments in Glendive, which is,
Okay.
so that's a need. And so what we're hoping to do is maybe have a certain day where we could take people to Miles City, to
Right.
Walmart,
There's
or, the different places.
Walmart in Miles
Yes.
City, and
Yes.
again.
Right, because, there's nowhere in
Right.
and there's not, there's clothing stores, but if you don't wear Western,
Right.
like Runnings and Ace Hardware and Tractor
Right.
Supply, and then there's another little clothing store, but they're kind of,
Yeah.
more on the younger side, but it's a nice store, but it's, yes.
Right, yeah.
So, it's just, the shopping is just hard in Glendive for things that you need. So we're hoping to be able to do that. We know we're going to be full pretty much every day, so it's going to be a job. We are going to be looking to hire drivers, so if there's anyone out there that, would be interested in driving, you can contact us here in Billings or in Glendive, because like I said, it'll be here before we know it.
And you said the vans are being built?
Yes.
Right. They're
the Montana Department of Transportation. Yes.
Yeah.
They're through them.
Right.
Yes.
Through a grant from the Montana Department of Transportation, and as I understand it, they're being built in the Midwest somewhere, like
I think so.
Indiana
Yes.
or somewhere like that. So again, and that's a process because they take it. It's almost, I don't know whether, are they building from the ground up accessible, or are they taking a van that Ford or General Motors has already built?
I think my understanding, and I may be wrong, and I hate to be wrong on TV, but it is, but I think they're building it from the ground up because there's certain specifications and stuff that it has to have.
Right.
But the one good thing about them is the drivers are not required to have a CDL license.
Yeah,
so they're going to be big enough to carry 11 passengers, but not big enough that you require a CDL license.
So that makes it a little easier to find drivers, because I know the CDL requirement has made it very difficult for many of our communities to find things like school bus drivers.
Yes.
But so that's interesting that we're going again, and expense-wise, we had to go the smaller route anyway. But but no, that's 11 people at a time, and that's still quite a number of folks who will be consumers of this program.
Right, and the thing that you don't think about a whole lot is dental, and in Glendive, I'm not sure about Miles City, but in Glendive, we don't have any dentist offices that take Medicaid.
Okay.
And so these people need to get to, Billings to the dentist. So that's one of the things we're getting a lot of calls about, that they need to go to the dentist, and we're just not there yet, but we will be, and I'm really, really looking forward to it. I think when the sports teams leaves to go on, like the divisionals or whatever at the end of the year, the fire trucks and the police lead them out, out of town with all the bells and whistles. So I think I'm gonna have to talk to them, and when we do our first transportation run, we're gonna have to get them to lead us out of town with the bells and whistles.
Yeah, that would be cool.
Yes.
Okay, so again, so you've been to most of certainly the eastern outlying counties in the course of this project, and is there anything that's beyond what you've said here that sort of sticks out from what people have said about what they need and what we can deliver?
Well, it's pretty much getting to Billings, groceries, things like that. The nursing homes, they have their own transportation, but they only have one van.
Right.
So if they're transporting somebody and something happens, same with the veterans home, they actually have to call, the ambulance or, something like that, because they only have the one vehicle. So our plan is to partner with the local transits. I know his name is David in Carbon County. He runs CART, that's the name of it, C-A-R-T. And
so Carbon County, that's Red Lodge.
Yes.
Okay.
Yes, he's the scheduler, the driver, pretty much he does it all. And he was in one of our focus groups, and I told him, I said, well, I'll be getting in touch with you, because he's got a really good, he's got it down where he can service people and stuff.
Carbon County is got a pretty good rural
Yes.
transportation program.
And but same with everybody else.
Mhm.
The roads are an issue, in the wintertime, and
Yep.
at least coming from Glendive to Billings, it's going to be interstate. So unless it's really bad, the roads are going to be clear.
Gotta watch.
Now
Gotta watch the Hysham Hills.
Yes, and I don't ever want to do that in the wintertime.
Yeah.
I don't like it in the summertime. But our problem would be if somebody in these outer areas, on these 2-lane roads, needs a ride in the wintertime, are we going to be able to get to them?
Great.
And we actually had somebody ask us if we were going to have a plow on the front of our vans. Well, no. We're going to do the best that we can with what we have. I know my husband will tell the doctors, don't schedule him before, until after March.
Right.
So he makes sure he gets it unless, something happens and you have to go. But there are some people, that drive and don't have a bit of trouble, and there's some like me from North Carolina who really don't care about the snow on the roads. So, and
So yeah, it'll be a learning curve for all of us.
yes, and in our focus groups, all of the directors, the drivers, everybody that was in the focus groups are really excited because let's take Powder River. In Powder River, which is Broadus, she's the only one that does it there. So she's,
Right.
Taking people to Billings and taking people to Miles City, and
Right.
she said that they have the vans, but they don't have enough. They don't have any drivers,
Right.
or enough drivers. That's another issue. Is they have the vans, so they have gone to Miles City and picked people up to take to Billings. If Miles City's vans, so it's like all the transportation in the area, they support each other.
Yeah.
and so
and so we're entering in as a piece of a bigger puzzle
yes,
that we hope to
and that's
contribute
good because
to.
we're all after the same goal to get the people where they need to go.
Right.
And
And
the older you
safe.
get, even if you have a vehicle, and you're 65. Well, I better say a little older than that, 70 or if you're older, that drive to Billings, is really
Yeah.
taxing on a person.
and
So
and there's no way to do it in the winter without
Right.
doing some of it in
Yes.
the dark.
yes, and it's been brought up about Cape Air, which I love Cape Air because I can go from Glendive to Billings in like an hour and 20
Right.
minutes. The price is right.
Right.
But if you are disabled or
Yeah.
tall or larger,
Yeah.
the planes just do not accommodate
Yeah.
you.
There.
So, that might be something that we will try to utilize, as things progress in our program. But right now, we're just looking at the vans for transportation.
Okay. That's neat. Trying to figure out here.
Where we're moving to next is
Yeah. So again, we've done these. We did these surveys last fall and up through about February. I
and the focus
and
groups
the
were
focus groups were
April and May.
April and May.
Mhm.
And so, is there another step in the planning that'll happen this summer? While we're waiting on the vehicles.
No, me.
Okay.
Am attending a lot of transportation conferences. I went to the Montana Transportation Association spring conference in Billings a couple weeks ago. That was very informative. We did a
Great.
driver's training class, which the guys that did that class were phenomenal. I learned a whole lot about what we need to have in our policies when we do our policy book. What you do in different situations, which a lot of that I never would have thought of, but they've been doing what they're doing for 25 years, so they've seen
Yep.
it all, and they both still drive, and they work for a transportation transit in Great Falls.
Okay. Yeah.
So that was real, that was really good. So we learned a lot there, and then we talked about insurance. We had somebody come and speaking on insurance, which in this conference. There were several individuals there talking about how their insurance had, like doubled. It really increased, and how what we're doing can fight, and still stay in business with everything increasing.
Right.
Gas is going down a little bit, but just not enough yet.
Mm.
So, it's going to be a struggle, but we just feel like everything is just falling into place like it's supposed to, and it's going to work out really nice. So it's just exciting.
Well, that's great. And again, we're looking at hopefully, the first part of 2026 for the inaugural trips, and
Yes.
and we'll definitely have more information as
we move
time
on.
progresses. But Tina, if people are interested in the transportation program, they can reach you through the office in Glendive, correct?
Yes.
That number is 406-948-8500. And again, we can we'll have some updated items on LIFTT.org here hopefully soon, and other things. And again, if we appreciate our viewers who take the time to watch this, whether you watch this on C7 or on the C7 website or on YouTube or on the LIFTT website. We appreciate the viewers, and we appreciate the comments we've gotten over the couple of years we've been doing this. Again, my name is Jed Barton, and thank you for watching, and again, visit LIFTT.org for more information. Thank you.